everyone, and you're watching The Doctor is In on CNN Philippines. I'm Dr. Freddie Gomez, and we hope to answer your many questions and medical concerns about COVID over the next half hour. So, some of the symptoms of COVID 19 are very similar to other diseases. That is why it is important that as we face this pandemic, we also equip ourselves with the right information. Napaka-importante po nun. So, in today's episode, we'll talk about the differences of the coronavirus infection from that of allergies, a sore throat, and that of a strep throat. And we'll even talk about tonsillitis in the mix. So to help me discuss all of that, joining us on the program is Dr. Maria Lourdes Enecilla. She is a head and neck surgeon and a fellow of the Philippine Society of Otolaryngology, head and neck surgery. It's good to have you here on the show, Dr. Mari.
Thank you very much for inviting me. It's an honor.
Now, the impact of COVID 19 varies depending on the person, and some might experience common symptoms just like having a fever, a cough, a dry type of cough, sometimes shortness of breath, fatigue, and muscle pains. Common yon with COVID 19. But also included in the list is a sore throat. So that's the focus of our episode for today. Paano natin ma-differentiate yon? So, Dr. Mari, could you please enlighten us? Paano ba ma-differentiate ba ang regular na sore throat with that of a COVID-19 symptom of sore throat?
Okay, so you're right that sore throat is one of the symptoms of COVID-19. But in the studies in large populations of those positive for COVID-19, like in China, this actually only happened in about 20% of patients. It's true what you mentioned that the more common still is the fever, dry cough, tiredness, headache, and difficulty breathing. So if you have sore throat and these other symptoms, and especially if you live in an area where there is high incidence of COVID, like well in Metro Manila, then you have to consider that maybe you might have COVID, not to scare people, no, but just for us to be aware and be careful. And so if you have the sore throat and these other symptoms, then you might want to consult with a doctor and consider being tested, especially if you think you might have had close contact with someone who was COVID positive, um, or if you're elderly and have other illnesses that might make the illness worse for you. So it might be good to have yourself tested. Um, so one thing that you can really
That's right.
sort of pinpoint you towards virus is really the existence of the other symptoms of fever, body pains, headache, that sort of thing.
That's right. And nowadays, we have a slight sense of worry. A lot of people have a slight sense of worry pag meron silang nararamdamang sensation sa throat, whether it's scratchy or maybe painful. So we can't help but associate it with it might being something serious. Mabuti na rin na naninigurado sila. So, Dr. Mari, let's start first with the allergic type of sore throat. Could you please explain to us what is an allergy-induced sore throat and what usually causes this?
Okay, so I guess before we can go there, it would be good to define about the sore throat. It's basically pain in the throat, like in swallowing. And you can, there's so many possible causes for this. And you can divide it broadly into two categories. One is the infectious and non-infectious. So with infectious, you have your viruses, your bacteria, your fungi, and usually you have fever with this because it's an infection. And the pain is usually very severe. And then you have the non-infectious causes of sore throat, wherein it's more of out of irritation, like when you're exposed to smoke or you ate something irritating. And included in this is when you have allergic rhinitis. No? So, for example, those who are sneezing a lot and they have a lot of mucus, then the mucus drips down to the back of their throat and gets stuck there and causes a lot of irritation. So you're always clearing your throat and you feel like we call it postnasal drip or something like mucus at the back of your throat. So with this, it's usually mild and it comes and goes. So when you have your allergic attack, then it's there, then it will go away on its own. and then it might happen again and again for weeks or months, but it resolves without any treatment, and of course you don't usually have fever with this.
That's right. So, to our viewers, katulad ng sinabi ni Dr. Mari, if you're not sure kung ano ba talaga ang nagkakos ng sore throat ninyo, it's best to have a checkup with the doctor, with your ENT, just to make sure whether it be an infectious type or a non-infectious type. Now, let's answer some of the questions online. Maraming nagtatanong, Dr. Mari, no? We have one question from Juris. Ang tanong ni Juris, what are some home remedies that you can suggest for a sore throat?
Okay. So I'm sure almost all of us have experienced our parents or grandparents telling us to gargle with warm salt water solution. So this has been there for decades and centuries because it works. It helps relieve the throat discomfort as long as you do it right. So about 1/4 to 1/2 teaspoonful of salt in 250 ml of water. And you gargle and spit it out in warm water, and this can help relieve the throat pain. Okay. It's important to drink lots of fluids, okay, to hydrate and try to eat because your body will help fight the infection, and you have to make sure you have enough nutrients. Usually, it's easier to swallow or eat if it's cold because it numbs the pain, or a little bit warm, but not very hot. So these are things that you can do, or honey. Honey can be very good as well, either mixed with tea or you take the honey itself and it can coat your throat and help you swallow and eat.
Okay, there you have it from Dr. Amari. Very cheap and effective home remedies for a sore throat. Meron tayong tanong din naman mula kay Kate. If I have a sore throat, what are the signs that I need to see a doctor? What do you think, Dr. Amari? Are there signs that can tell the patient that this is a little bit more serious, that they need to have it checked by a doctor already?
Okay. So first, if it's an infection, you should see a doctor. So again, the signs would be if you have fever and if the pain is a little bit severe, lasting for about 2 days, it's constantly there, then you should consult. Ideally, first via online or teleconsult because we're in the midst of a pandemic. But some signs that it's very severe and you might really need to go to the emergency room or have a face-to-face consult is if you really can't swallow anymore, even the medicines or water. For the children, you'll see them drooling. They can't even swallow their saliva. So those are very serious signs that they have to be brought to the hospital. Fever that does not go down. Signs that there's already blockage is if there's muffled voice. We doctors call it hot potato voice, or it's like, okay, so it's like there's something blocked up there, or noisy breathing, or signs that the infection is going deeper is when the patient can't move the neck, so they're stiff neck, or they can't even open their mouth. So those are signs that the infection is going deeper and you have to go to the hospital and seek consult.
Okay, very good advice. So we'll continue those questions after the break. But after that, still coming up, we talked about allergy a while ago. Later on after the break, we'll talk about the infectious reasons for sore throat. So stay tuned for that. You're watching The Doctor Is In on CNN Philippines. Freddie Gomez, and welcome back to The Doctor is In. Thank you very much for joining us. Now, the goal of our discussion today is to give you the knowledge to differentiate sore throat and or non infectious from that of symptoms of COVID-19. So, pag-usapan naman natin ang strep throat at ano ang rason kung bakit nagkakaroon nito. So let's continue our discussion with Dr. Maria Lourdes Enecilla, who is an ENT head and neck surgeon. Now, many of us, Dr. Mari, have experienced having sore throat. Iba-iba ang mga sanhi nito. So it can be due to an allergy na pinag-usapan na natin kanina at maaari rin itong bacterial or yung infectious type. So, Dr. Mario, what exactly is strep throat? How common is this? And is this something that people should be worried about?
Yes. Okay, so when we talk about strep throat, this is caused by a bacteria, specifically Streptococcal pyogenes. So we talked earlier about non-infectious and infectious causes of sore throat. So this will fall under infectious. And under infectious, a big majority is actually caused by viruses. And among the bacterial causes, it would be your strep throat, which is the most common. So it's something we have to be aware of because with this, we have to treat it because it can become a complicated infection and uh, it's actually an infection that can easily spread as well.
Okay, that's very true. So this is something that shouldn't be taken lightly. And because of that, let's talk about symptoms naman of strep throat, doctor. So how can we say that a person has strep throat? Is there a particular age group at risk of this? Is there a difference doon sa sakit na nararamdaman kapag strep throat na?
Okay, so it can actually happen at any age, but it's most common in children. So with this, bacterial infection of the throat, usually it's very painful, so and sudden. So sudden, acute, severe throat pain, and usually, of course, because it's an infection, there's fever. And unlike your viral infections, there's usually no cough. Okay, it's just really the throat pain, and usually don't have the body pains, the joint pains. It's mostly in the throat. But that's for adults and adolescents, teenagers. In children younger than 5, some of them might have cough and runny nose and even nausea and vomiting. But more often than not, it's just really the throat pain and fever. And you also have enlarged lymph nodes, so parang may bukol-bukol dito sa leeg, yung mga malalaking kulani. And in the throat, you will see redness, and sometimes the tonsils are large, and they're like white patches or parang nana in the tonsils. So those are clues that it is a bacterial infection caused by Streptococcus pyogenes.
So we should be very mindful about these symptoms na minention ni Dr. Mari, especially if it already requires medical attention. Now let's talk a little bit about tonsillitis naman, which may also cause a sore throat. So just for our viewers' sake, your tonsils are considered as one of our body's first line of defense against bacteria and viruses that may enter through the mouth. Kaya napaka-prone nito sa infection. Now, Dr. Mari, how is tonsillitis different from, say, the sore throat that we just talked about, the strep throat? And what are some of the things that the viewers must be careful of knowing or wary about when it comes to tonsillitis?
Okay, so actually, your tonsillitis or enlargement of your tonsils can actually also happen with strep throat. So when we talk about tonsillitis, it's because the infection is already there. Your tonsils, they're like these balls at the back of your throat, gets large and they can have pus. But it can get infected by, again, a lot of different things, whether viruses or bacteria. But strep is one of the common causes of bacterial tonsillitis. And it's important to be aware of this because one, if it's bacterial infection, then it should be treated by antibiotics and the correct antibiotics and the correct duration and dosage, which would be prescribed by your doctor. Otherwise, if you do not treat this properly, it could lead to infection. So it's possible that the infection will go deeper or not resolve. In it usually resolves within 5 to 7 days, but if you don't treat it, then it might get worse. Also, if incomplete treatment, sometimes that's when the patients have recurrent tonsillitis because they didn't really eradicate or kill all of the bacteria. There's still bacteria there hidden in the tonsils, and that's why it keeps coming back. And that's usually because of incomplete treatment by the patient. So it's very important to follow your doctor's advice.
That's right. So again, proper treatment is the key to this. That's something to watch out for. Now let's answer more questions posted on the CNN Philippines Facebook page. We have a question from Maricel, which is quite interesting. Tanong ni Maricel, ano po ang kadalasang dahilan ng strep throat? May mga dapat bang iwasan katulad ng matatamis na pagkain? What do you think, Dr. Mari?
Okay, so because it's caused by a bacteria, it's basically good hand hygiene, especially for the children. Because before COVID, when the kids are in school and one child has strep throat, then if they cough, or they share utensils, then it's possible that they can spread it to their classmates. So it's still proper hand hygiene when after coughing, especially or blowing their nose. Um, Now, it is true that I've heard often patients telling me that they get sore throat because of eating sweets, chocolates, or drinking soft drinks. If ever the sore throat can be triggered because of the sugar. So that sugar, if there's already bacteria in your throat, then it's possible that the bacteria will proliferate or cause a lot of throat irritation. But it doesn't necessarily cause the infection. The infection is still caused by the bacteria. What's important after you eat your sweets or your chocolates, just make sure you drink lots of water and you brush your teeth or you gargle so that the sugar doesn't stay there. It's still proper hygiene and oral hygiene.
Okay, very good tips. Thank you very much for that, Dr. Enecilla, for joining us and sharing your expertise, especially on this topic. I'm sure a lot of viewers have learned how to differentiate and how to spot now what kind of sore throat they may have.
Okay, thank you very much for inviting me.
Now, when we return, we'll talk more about what can cause trouble in your throat and when not treated properly may affect other organs like your heart. Stay with us right here on The Doctor's In. Welcome back in on CNN Philippines. I'm Dr. Freddie Gomez. We continue to answer your important questions about COVID-19 and in for today about sore throat. Mga pwedeng dahilan ng sore throat pa rin ang pinaka-focus ng episode na ito. But let's shift our focus now on your heart. Because a sore throat that is not treated properly, an infectious type of sore throat for that matter, can lead to something more serious like rheumatic heart disease. To help us define or figure out what exactly ang nangyayari with this type of disease, we have pediatric cardiologist Dr. Juliet Balderas. She is the chairman of
Hello.
the Philippine Heart Association Council on Rheumatic Fever and Rheumatic Heart Disease. Welcome to the show, Dr. Juliet.
Well, hello, Dr. Gomez. And thank you for inviting me to
Great
give
to have
light
you.
on
Now,
sore throat.
yes, of course, we're always glad to have your knowledge here. Now, Dr. Juliet, we learned earlier how a sore throat can be caused by strep throat or an infectious type of sore throat. But a strep throat that is not given the proper attention may lead to rheumatic fever and possibly even rheumatic heart disease. Can you explain to us how is this possible?
Okay, rheumatic fever is only caused by streptococcal sore throat, which means it is due to the bacteria. So there are two factors here. The virulence of the bacteria, malakas siya talaga, plus the susceptible host. Ibig sabihin, some of us may have a low immunity, so that over time, sore throat or bacterial sore throat, which is incompletely treated o kaya undetected, and therefore there is no antibiotic, can go to the heart. So which means yung proteins ng bacteria can mix with the protein of the susceptible host. And ang most common affected are the valves of the heart. So they deposit in the valves of the heart. And therefore, you have what you call rheumatic fever. Of course, not all sore throats can go to the heart. Kung sabi nila, you have a 0.3 to 3% incidence of a sore throat going to the heart. Pero if you are a susceptible host or have a previous history of rheumatic fever, the incidence is 50%. So treatment is very important. So sinabi ni Doktora kanina, how do you detect a true strep throat? A true strep throat is bacterial. So the only treatment, of course, is an antibiotic. Adequate antibiotic, which means the ordinary amoxicillin, no? Amoxicillin or penicillin can treat the sore throat. Hindi lang important is the right choice of the drug, the right antibiotic, but the right duration. Many of us will treat a sore
That's
throat
right.
as an ordinary virus. Tapos they give an incomplete antibiotic for 3 days. So dapat for it to prevent going to the heart, it has to have a full treatment, and full treatment is only 7 to 10 days. So that will prevent the bacterial strep throat from going into rheumatic fever. Sabi nila, how long is the duration? How long from an ordinary strep throat to go to a rheumatic fever? In a susceptible host, it's usually 2 weeks after. Pero sabi natin, kung minsan we're not
Okay.
able to detect, no? So pupunta tayo when you already have the symptoms of rheumatic fever. So 2 weeks po for an incomplete treatment.
That's right. So, ang importante talaga is makinig sa doktor. Kapag binigyan kayo ng antibiotics for a certain period, kailangan tapusin or ubusin ng antibiotics na iyon. Ano? So, like what you mentioned, important to know, but prevention is actually somewhat better in some cases. So, when we talk about
Yes.
infection, isa sa mga solusyon ay ang proper hygiene, katulad ng regular hand washing. And it also helps to separate your eating utensils when you have a sore throat or an infectious type of sore throat, because this can be a way of spreading it to other people. Now, Dr. Juliet, what can people do to prevent their sore throat from becoming something more serious?
So good nutrition, of course, good hydration will be very important for increasing your immunity against the virus. And tama kayo, actually the most common reason for it to spread is ano yun? Uh, Overcrowding, no? Overcrowding can be a cause of transmission of a bacterial strep throat to other people. So good nutrition, hydration, and of course, go to your doctor. If the sore throat does not improve after 3 days, then most likely it's not viral. Kasi pag viral, gagaling siya kaagad eh. So you will need an antibiotic. So tama si Doktora earlier when she said, look at the lymph nodes. The lymph nodes will detect or will decipher between a true strep throat versus a viral. Ang viral, hindi kailangan ng antibiotic. But once the doctor gives you an antibiotic, masakit ang the lymph nodes, then you need the antibiotic and you have to complete. Sa Philippines, our most common problem is completing the antibiotic. So of course, some people, it usually hits children 5 to 18 years of age. So, gumagaling na sila after 3 days, so they do not give a complete dose of antibiotic. So, for the doctor, they want to detect will the patient be able to complete the antibiotic. So, ngayon, that is the move that we are trying to promote among pediatric cardiologists, that if you live in a far-flung area, like in the barrio, and usually libre naman ang amoxicillin in most of our health centers. But if you are not sure that the patient is able to come back, one dose of IM benzathine penicillin, yung isang injection is good as the 10 days antibiotic. So that is good enough to prevent a sore throat leading to rheumatic fever. Sabi nila, that's an 8% prevention of rheumatic fever. If you complete your antibiotics, that's a 70% prevention. So which means that complete dose of antibiotic is really the key to prevent rheumatic fever. So we have a lot of cases of RFRHD in the country. In fact, if you have 40,000, over 100,000 is
Okay.
the true prevalence rate. And it is really the objective or the thrust of the Philippine Heart Association to cause a stop and prevention of RFRHD. And going to primary care is
Okay.
really treating the sore throat.
Okay, so that's very good information that you shared with our viewers, Doctora, and would like to thank you very much for joining us today and sharing those tips and those latest information when it comes to rheumatic fever and rheumatic heart
Thank
disease.
you
So thank
very
you
much.
again, Dr. Juliet
Okay,
Balderas.
bye-bye.
And thank you also to all our viewers who have sent in their questions. So, with a rising number of COVID-19 cases in the country, we should be more cautious with our everyday routine. Kung wala namang importanteng gagawin sa labas, ugaling manatili lamang sa bahay. So, act like you have the virus to protect yourself and others. This has been The Doctor Is In. I'll see you again tomorrow at 3:30 p.m. I'm Dr. Freddie Gomez. Stay safe, everyone.